You just got a positive ANA test, and your doctor said, I need to refer you to a specialist. The next thing that you're going to do, you're going to jump on Google or ChatGPT, and you're going to start your search. Does this mean lupus? Does this mean something serious? I'm Dr. Girnita, a board-certified rheumatologist, and in the last 15 years, I have seen thousands of patients in my practice which were confused, scared, and dismissed by the system after getting this result. In this video, I am going to walk you through what exactly is a positive ANA test and what it means and what it doesn't mean, and the 5 most common reasons for you to have a positive result. And one of these things your doctor might have not told you, but it changes everything. Plus, I will give you all the questions that you need to bring to your next appointment to your rheumatologist for you to be prepared. So stay with me because this video could save you many months of confusion. What is the ANA test? The ANA test is a screening tool, like the airport metal detector. It beeps for a lot of things, but it doesn't mean that everything is dangerous. Now let's start with the basics. ANA stands for antinuclear antibodies, and these are proteins that your immune system produces, normally to fight foreign invaders, like viruses or bacteria. But sometimes your immune system gets confused, and instead of attacking the foreign invader, the bacteria or the virus, it starts attacking your own cells. And when that happens, these antibodies are formed. So that's what the test detects. Now here it is how the test works. Your blood is mixed with a special type of cell. If the ANA antibodies are present, they bind to those cells. And then a fluorescent dye is added, and that will make the visible antibodies under the microscope. Very simple, right? But here it is where most patients get confused. The test will give you 2 information: a titer, which is the concentration level, and a pattern, which tells you where inside the cells the antibodies are binding. And both matter, but neither one will give you a diagnosis on its own. Now let's talk more about the titer. A small titer like one, it's found in up to 31% of healthy people, which is very common, which often means nothing. A titer of 1 to 80 is still seen in 13% of healthy people. A titer of 1 to 160 is seen in 5% of healthy people. So start paying attention. Now, a titer of 1 to 320 and above that becomes clinically meaningful, but this is still not a diagnosis. But here it is the truth. The higher the titer, the more antibodies are present in your blood. But even with a high titer, without symptoms, it is not a diagnosis of autoimmune disease. That's why you need a rheumatologist to be able to connect the dots, not just to look at the number on a lab report. Now let's talk about the ANA pattern. A homogeneous pattern means that the entire nucleus is stained, and that is usually seen in patients with lupus or mixed connective tissue disease. A speckle pattern means that just a few or a fine course of speckles are seen, and that is also more common in patients with Sjogren's or scleroderma. A centromere pattern is more seen in patients with scleroderma or CREST syndrome. And the nucleolar pattern means that only the nucleolus, the small part of the nucleus, is stained. And that is seen more in patients with scleroderma or myositis or inflammatory myopathy. But here it is what I want you to remember, because this becomes complicated. The pattern is a clue, it's not a verdict. Think of it as a fingerprint at a crime scene. It helps to point out in a direction, but it doesn't close the case. So what should you do in this situation? Only a full clinical evaluation will help you further. So now that you know what the test detects, what are actually the causes of a positive result? And here it is where most patients are shocked because the answer is not always what you would expect. Your positive ANA could be caused by 5 completely different situations. And I guarantee you that at least one of these causes will surprise you. Number 1, autoimmune diseases. Yes, ANA positive, this is the big one. Connective tissue diseases like lupus, Sjogren's disease, scleroderma, inflammatory myositis, rheumatoid arthritis, they can all cause a positive ANA. But here it is something that is very critical. Almost 99% of lupus patients have a positive ANA. And that's why the ANA is part of the lupus diagnostic criteria. But, and I cannot stress this enough, you can have a positive ANA and it doesn't mean that you have lupus, because the diagnosis of lupus requires much more than that. Requires specific symptoms and other targeted antibodies like double-stranded DNA or anti-Smiths, and it requires a full clinical evaluation. Then autoimmune thyroid diseases like Hashimoto or Graves' disease, and even autoimmune diseases of the liver like autoimmune hepatitis or primary biliary cirrhosis, they can also cause a positive ANA. So this test doesn't just point towards rheumatology. It can point towards a bigger picture of autoimmune diseases. Number 2, chronic infections. Now, I know this one surprises many people, meaning infections. When your body fights a chronic infection, something like EBV or the Epstein-Barr virus, which causes mono, or CMV, or HIV, or hepatitis B or C, or Lyme disease, or tuberculosis, or even syphilis, your immune system is constantly activated, and that constant activation will generate autoantibodies, including ANA antibodies. And I have seen multiple patients in my practice that they come to me with this idea, terrified idea that they have lupus, and after a thorough evaluation, we find out that they have a chronic EBV infection that was actually driving the positive ANA. And once we address that, the picture changes completely. And that is why testing for chronic infection is part of my complete evaluation here at Rheumatologist on Call. Number 3, medications. This one I know shocks patients every single time, because there are certain medications, even some that you probably take right now, that can cause the autoimmune system to produce a positive ANA. And I'm going to give you examples. Blood pressure medications like hydralazine, or other cardiac medications like procainamide, or antibiotics like minocycline, and even TNF inhibitors, biologics like Humira or Enbrel that are used for rheumatoid arthritis or psoriasis. They can also trigger a positive ANA, and in some patients they can even trigger drug-induced lupus. Let me tell you about other classes of medication. The newer cancer drugs, the immunotherapy drugs, the checkpoint inhibitors. These are very powerful immune modulators, and they can absolutely cause positive ANA test, and they can fully cause an autoimmune disease. So in my practice, most of the time, I ask my patients, what are the medications that you are taking at this point? Number 4, cancers. I know this is very hard to hear, but I need to mention it because this is real. There are certain cancers like lymphomas, breast cancer, lung cancer, ovarian cancer that can trigger positive ANA. And many studies show that ANA positive in cancer patients are between 15% and 65% depending on the type of cancer. Plus, radiation therapy or immunotherapy, as I said, that we use to treat cancers can also cause the body to generate these antibodies. But I want you to remember that the fact that you have a positive ANA, it doesn't mean that you have cancer. It means that you need a very thorough evaluation that will also include information about cancers or a history of cancer, which in this case becomes relevant. Number 5, healthy people. This is the one that I really want you to pay attention. You can have a positive ANA and you can be completely healthy. Because as we age, our immune system will get exposed to many triggers, infections, medications, environmental factors, and many of us will develop a low-level ANA, which can develop without the presence of a disease. A 1 to 40 titer in a 55-year-old woman with 0 symptoms may be entirely normal. So that is why your clinical picture, your symptoms, is what determines whether the number means something or not. And that is why I always say the ANA test does not make a diagnosis. Only a physician like me, a rheumatologist, can make the diagnosis. So now that you know what's causing the positive results, there is a question that many of my patients will ask me. When should I be worried? What are those enough to cause panic? But there are some specific combinations of symptoms and certain other results that are your signal to act. A positive ANA combined with any of these symptoms means that you need to see a rheumatologist. You don't have to wait. You just have to call and make an appointment with a rheumatologist. And those symptoms are morning stiffness that will last more than an hour, unexplained rashes, especially a butterfly rash across the cheeks, if you have severe persistent fatigue that is not explained by poor sleep, if you have significant hair loss that is diffuse or in patches, if you have sensitivity to the light, which we call photosensitivity, if you have Raynaud's phenomenon, which means that your fingers or your toes will turn white or blue in the cold weather, if you have dry eyes or dry mouth altogether, if you have swollen joints, especially when you have symmetric swelling in both hands, if you have unexplained fever or enlarged lymph nodes, if you have that positive NA, and if you have 2 or more of these symptoms, do not wait 6 months for an appointment. Schedule your evaluation as soon as possible because an early diagnosis in autoimmune diseases changes your outcome. It prevents your joint damage. It prevents organ damage and disability. And yes, you can access a board-certified rheumatologist within days, not months, through telehealth. And that's exactly what we do here at Rheumatologist on Call. But before I wrap up, there is another question that I get very frequently in my clinic, and I want to answer it directly. Can COVID-19 cause a positive ANA? And the answer is yes. People with a history of COVID develop a positive ANA. Over the past 4 years in my practice, I've tracked the pattern, and that pattern is now backed by science. A significant percentage of patients who had COVID-19 infection, they range from 30 to 60% of the study, they have developed positive ANA tests. And they also develop other types of positive antibodies like double-stranded DNA, SSA, SSB, and many others. A Canadian study found out that the levels of ANA, they peak at 3 months after the infection, and then they gradually start to decline. But for some patients, that means much more, because if they have the genetic predisposition to develop an autoimmune disease, COVID-19 appears to be a trigger for conditions like rheumatoid arthritis, psoriatic arthritis, or lupus, and even new onset thyroid disease. The natural infection tends to produce a more broader immune response rather than vaccination. Encounters multiple viral proteins rather than just the spike protein, which is in the vaccine. But I've seen antibodies develop in both situations in my clinics. What does it mean for you practically? It means that if you had COVID-19 infection, especially a severe case, and now you have a positive ANA with new symptoms, this connection might be real and you need to be evaluated by rheumatology because this is not in your head. Now, let me bring it all together for you. A positive ANA test is not a diagnosis. It is a signal, the beginning of an investigation. It can come from autoimmune diseases, yes, but it can also come from chronic infections, certain medication, cancer history, and COVID-19, or from simply aging. What matters for you is the full picture. Your symptoms, your titer, your pattern, your history, your medication, and it matters to find a physician who has the time, the expertise to connect these dots. If you have a positive ANA and if you have been dismissed, told to wait and see, or if you're bouncing back between specialists with no answers, that's why we build Rheumatologist on Call. We are board-certified rheumatologists trained at the best world-renowned institutions, and we see patients across many U.S. states through telehealth. And we provide a comprehensive evaluation that you deserve in a few days, not in many months, without this referral maze. The link to schedule an appointment is in the video description. Now, there is so much more to discuss about positive ANA test and many other laboratory tests to detect autoimmune diseases. And if you stop here, you will continue to be confused, you will continue to get incomplete answers, and maybe you will continue to leave your appointments without a real plan. So watch my next video, because I will tell you everything that you need to know, that you need to do after you have a positive ANA, and that will help you to understand what your rheumatologist needs to do for you. Don't leave without watching it.